As Canada's wildfires continue to prompt air quality alerts across the U.S., a lot of parents worry that it may impact their children's health.
Yeah, this has been the worst year on record for Canadian wildfires, but the fact is even ordinary pollution has an important effect. Dr. Frank McGeorge is here with information on how it adds up and how much it concerns a lot of parents.
Well, you know, Kim and Devin, it definitely bothers parents. In fact, a national poll from the University of Michigan C.S. Mott Children's Hospital finds nearly 3/4 of parents are concerned about poor air quality. In fact, almost 1 in 5 parents who reported experiencing at least one day of poor air quality in the past 2 years believe that poor air quality has impacted their child's health.
Air quality concerns start in the womb, according to Dr. Susan Wolford, a pediatrician at University of Michigan Health C.S. Mott Children's Hospital.
Even before they're born, they gain less weight and they're born with a lower birth weight than when their mothers were not exposed to pollution.
And problems compound over time.
When we think about toddlers and infants, their brain development and their behavioral development can be impacted by pollution. And then for children of all ages, they're more likely to develop lung disease, asthma, and in fact childhood cancers if they're exposed to pollution. Air quality is particularly important when it comes to children's health because children breathe at a faster rate than their parents, and so they have more pollution getting into their lungs per pound of their body weight than for adults. They also spend more time outdoors, and they spend that time closer to the ground where much of the pollution is concentrated.
Dr. Wolford recommends these steps to help protect your kids.
So, first of all, they can avoid letting their child do activities outside, particularly strenuous ones where they may have to breathe rapidly or deeply, and then move those activities indoors. They can also try to have outdoor activities earlier in the day where air quality might be better. And if they move activities indoors, they should attempt to filter the air indoors.
Now, over 90% of parents said they get their information on air quality from the news or weather reports. Now, of course, there are also air quality apps that people can use that have become better known during the worst of the Canadian wildfires. And incidentally, the majority of parents actually said schools should also take action when the air quality is poor.
I'm still trying to consider that because kids are so little, that they're closer because pollution gathers, air pollution gathers closer to the ground. Isn't that something? But I'm going to assume that this has to vary from location to location, so it's a very hyper-local concern, right?
Yeah, you know, so a lot of it actually depends on the type of pollution. So, of course, with the wildfires, for example, it blanketed large areas all at once, but pollution can be hyper-local. For example, if you live near a factory or an expressway, the exposure levels can actually be very significant and very different, and that is why it affects different socioeconomic classes very differently.
Yeah. Okay, thanks, Doc.